Airway analysis. Conventional radiography and reconstructed 2D CBCT images provide similar assessment of the airway. In comparison, axial cuts of 3D CBCT scans provide soft tissue points that are derived from the projection of the shaded areas, which are more clearly visible in the axial CBCT cuts compared with conventional radiographs, thereby enhancing the airway assessment. This was stated by Bozzotto et al. In 2012. Three-dimensional CBCT assisted airway analysis also facilitates the diagnosis and treatment planning of complex abnormalities, including enlarged adenoids and obstructive sleep apnea. In 2007, Ogawa et al. Stated that airway morphology in the obstructive sleep apnea affected patients. The affected patients showed a significant decrease in airway volume, area, and distance, thereby highlighting the importance of CBCT in the diagnosis of this condition. Cleft lip and palate. Preoperative assessment of the volume and location of the bony defects in patients with cleft palate. Planning grafting procedures or surgical procedures necessary for correcting the bony defects. These two are considered the most important means by which CBCT helps us in diagnosing and treating the cleft lip and palate patients. Orthodontic surgery. So malocclusion is associated with a jaw discrepancy that can be treated in three ways, either by growth modification, camouflage, or orthodontic surgery. In patients with skeletal malformations and traumas, preoperative surgical planning and simulation can be carried out with the help of a CBCT 3D surface reconstructions of the jaw bones. Treatment options can be recreated or checked with the help of virtual models of anatomical structures fabricated from the CT volumes and registered in a three-dimensional image data, which are capable of creating anatomically correct substitute grafts. It helps the clinician to execute a proper diagnosis. Almeida et al. In 2011 stated that CBCT volume-derived virtual facial models evaluated post-surgical changes in the soft tissue overlying the mandible in response to mandibular advancement surgery. They superimposed the virtual models of the cranial base and used colored maps to quantitatively evaluate the surgical and post-surgical changes. CBCT reconstructed cephalograms. The aim of the study was to assess whether the values of different measurements taken on 3D reconstructions from the CBCT are comparable with those taken on the 2D images from conventional lateral cephalometric radiographs, and to examine if there are differences between the different types of CBCT software when taking those measurements. In this study, 8 patients were selected. An observer took 10 angular and 3 linear measurements on lateral cephalogram and CBCT on 2 different occasions. The study concluded that no statistically significant differences were found between the angular and linear measurements taken with the lateral cephalogram and those taken with the CBCT. Finally concluding, we can say that CBCT is an exponential advancement that holds the capability to improve orthodontic diagnosis and treatment planning. Considering the risks of CBCT, which outweighs the benefits in orthodontics, CBCT should only be advised when necessary. That is, its use should be case-specific, in which the clinician should be able to justify the reason for CBCT acquisition. With the advancement of technology, CBCT is bound less in changing future orthodontics with respect to the clinical assessment of the patients. Coming to the critical appraisal, the title is clear and informative, the abstract is unstructured, the text is well written, ideas and materials are correctly attributed. Research design, it's a review article. Discussion and conclusion, discussion is not clearly stated, whereas the conclusion is clearly stated. References are adequate in Vancouver style. Opportunities, we can incorporate a CBCT with a 3D printing for treatment planning that can be very useful in the department. Coming on to the related studies. So this is a case report of an 18-year-old female who presented with a chief complaint of forwardly placed mandible. The patient had a mid-facial deficiency and a prognatic mandible. This case report thereby shows that the successful management of severe class 3 dentofacial deformity, combined orthodontics and bijog orthodontic surgery, adjunctive diagnostic aid in the form of CBCT was judiciously utilized to aid in the treatment planning, improve the prognosis, and audit the results. The results were audited after the treatment to see if the amount of root resorption, how much is the amount of root resorption? Like, are we not creating any iatrogenic diseases or difficulties in the patient? Coming on to the next study, this article describes one orthodontic case found accidentally an ectopic tooth in maxillary sinus by inspecting the CBCT images. A 15-year-old male patient had reported with orthodontic requirement but accompanied with mild pain and recurrent pus discharge from his left maxillary sinus since the last 1 year. Symptoms reduced with antibiotics, but then they recurred again after 1 to 2 weeks. The patient also reported about stuffy nose and congestion. There was no history of systemic disorder or maxillofacial trauma. The patient was indicated for CBCT for orthodontic purpose and also maxillary inspecting. CBCT image revealed an ectopic maxillary third molar near the roof of the left maxillary sinus with a cystic lesion surrounded. The mucosa of the sinus was thickened, suggested that the chronic sinusitis conditioned the CBCT image. This article presents a case of a 22-year-old male patient who sought orthodontic treatment for correction of his narrow-line teeth. The pre-treatment OBG revealed an unerupted mesodens between the two central incisors, prompting further investigation with CBCT. The CBCT images revealed unusually large maxillary sinuses on both the sides, with the left sinus reaching the incisive foramen and being in close proximity to the unerupted mesodens. The imaging and information from it aided in careful surgical removal of the mesodens and subsequent orthodontic treatment. This study tried to assess the contribution of CBCT in the preoperative evaluation and further treatment of patients with impacted third molars and mandibular bone with high risk of inferior alveolar nerve injury. 3 clinical cases were presented showing positive signs on standard OPG, which exhibited indicators of potential contact between the inferior alveolar nerve and the impacted lower third molars. For an improved exploration, CBCT was used. The study showed that compared with panoramic radiography, CBCT had improved the evaluation of the surgical risk and allowed a more accurate planning of the surgery. These are the CBCT images that were taken, and then this helped in the accurate planning. Over here, we can clearly see how close the inferior alveolar nerve canal is and from the impacted third molars, and hence helping in the evaluation and treatment plan of treating the patient. This last study shows invasive cervical resorption, which invades the tooth from the periodontal ligament, apical to the epithelial attachment, and it's not evident clinically in the early stages. So the lesions vary from well-delineated radiolucencies that are quite obvious to clearly defined lesions with irregular borders and sometimes resemble caries radiographically. The key aspects are the location, size, and accessibility of the lesion and the structural integrity of the tooth to assess and treat the invasive cervical resorption. Therefore, this article concludes that the cone beam computed tomography imaging is a valuable tool for management of such cases. So the Joint Journal Club seeks to emphasize the importance of CBCT in our day-to-day practice. The best way to increase knowledge is by sharing knowledge. As it is rightly said, individually we are one drop, but together we are an ocean. So with our collaboration with the Oral Medicine Department, we are striving to understand CBCT better and explore further possibilities of CBCT use in orthodontics. Thank you.